Okay, so we're going to talk through how to use the positive airway pressure device that is used here at my clinical site. They use what's called the Accupap. This device is similar to an EasyPap. However, you don't have to use the pressure gauge because you are able to actually dial the pressure on this particular device. And so, of course, you need to check your physician's orders before you do any type of treatment. And then you need to assess your patient as far as general appearance, breath sounds, vitals, SpO2, etc. So because of the price of this particular type of device, I am not allowed to take it out of the packaging. So I'm going to talk you through it the best that I can inside the packaging. So this is what it looks like. You have a mouthpiece on this side. This was going to hook to the flow meter, and you set that dial to 10 for your flow. And then up at the top, you can actually dial in, like I had said before, you can dial in your pressure, so you can get that 10 to 20 centimeters of water pressure if you just turn the dial. So you're going to use this hose to hook onto here, to hook to the flow meter at 10. And then for this device, you don't need the pressure gauge like I previously stated. Also, this is going to be used to help move secretions, to help reverse atelectasis. It's going to help to reduce air trapping in those patients with asthma and COPD. And you can also use this device with a bronchodilator, so it's going to help optimize the performance of that medicine. So if you were to use a bronchodilator with this device, you would remove the mouthpiece, and then you would put your corrugated tubing into this part of the machine, and then it would just kind of elongate. You'd have your neb cup with your bronchodilator and your mouthpiece, so it would just make it a little bit longer. On the EasyPap, you just kind of like screw it into the bottom, but this is a little bit different device, so you don't do that with this particular device. And then, of course, you're going to reassess your patient at the end of the treatment. You're going to re-listen to the breath sounds and get the vitals and see if this device is doing its job as far as helping to reduce those secretions and atelectasis reversal for those patients. Anytime you have a patient that is experiencing any type of distress with treatment, you need to do the triple S. So you need to stop, you need to stay with that patient, and then stabilize them. So that's just kind of how you use this particular device.